Hello friends, I am Dr. Rajendra Shinde, practicing dermatologist from Pune. Today I will be speaking a few words about vitiligo on behalf of DermaVidya. Now vitiligo is a disorder of the immune system resulting in whitish patches on the skin. It is the immune system which destroys the melanocytes, resulting in the formation of white patches. One important thing to know about this is the melanocytes are derived from the nerve cells, and just like nerve cells, once they are destroyed, will not be recovered back. Now vitiligo has a tremendous impact on the life of an individual. The moment you make the diagnosis of vitiligo, the patient's whole family is disturbed. This is because of its misconception with leprosy. In the previous ancient literature of Indian various books, we find that vitiligo is mentioned as Shwet Kusht or white leprosy. This is because until the cause of vitiligo was not known, it was considered as leprosy, and these patients of vitiligo were also segregated along with leprosy patient in leper homes. So that is the confusion which has been prevailing for years together, and hence this has been prevailing since time and ages. One very important in the management of vitiligo is not only the treatment and the various therapies, but the lifestyle of the individuals. And the most important thing is the stress level. For the first time, you will observe that vitiligo comes when the stress levels in the body are very high. Adequate sleep and a very balanced diet is also a very important aspect in the management of vitiligo, but not as important as the stress factor. Phototherapy is one form of treatment of vitiligo. But what exactly is this phototherapy? Photo means light and therapy means treatment. So this is one of the treatment for vitiligo. Now you all know that when we go out in the sun, we get a tan onto the skin. And this exactly is the effect which we use for vitiligo. With the help of sunlight, those rays of the sunlight spectrum which are useful or which causes pigment to increase in the skin are used in the therapy. And those pigments are in the range of two wavelengths, principally called as UVA or UVB. UVA, the wavelength is 320 to 400, and UVB, the wavelength is 290 to 320. Now these are the wavelengths which are given onto the skin in concentrated manner to give the effect of increased pigmentation in the skin. Now there are various types of phototherapies used. For example, some of your dermatologists may give you a drug and ask you to stand in the sun after say about 1.5 hours. This is the period which is required for the drug to reach onto the skin. This is called as PUA sol, where we use the sun rays as the source of light and sorelin as the group of drug. Another treatment of phototherapy is in the form of handheld units. Now depending on the length of the lights or the tubes used, we have different units, which may be hand units or the scalp units or the full whole body units, which are very important. But here I would like to highlight the one which is very useful is the whole body UVB chambers. But the only disadvantage of these chambers is that you have to go to the clinic 2 or 3 times a week to take this treatment, and this treatment is from 6 months to 1 year or even more than that, depending on your vitiligo. Since we are using one form of UV rays, the protection of the genitals and the eyes is of utmost importance. And whenever you are taking phototherapy, please pay special attention to this factor. Is phototherapy safe? Yes, it is absolutely safe. It is so much safe that it's the only form of therapy, systemic therapy, which is used in pregnancy. So you can imagine that therapy which is used in pregnancy will always be safe for you. Of course, the side effect depends on the number of joules you have received. If you have received some excess number of joules, you may get redness onto the skin, or you may get blisters onto the skin, or you may get pain onto the skin. Of course, this is temporary and your dermatologist will definitely manage this. Within 4 to 5 days, you will be free of this. And of course, if the treatment is of adequate quantity, these side effects are very rare. The newer treatments are usually narrowband UVB phototherapy, and this wavelengths hardly give rise to long-term side effects in any case of vitiligo patient. Phototherapy can be combined with various other modalities. We have already covered the use of sorellins with phototherapy. Then we can use other drugs like azathioprine also, or we can use topical creams like tacrolimus to aid in rapid healing of your vitiligo patches. Now, why do some patients have a very good response and some patients do not have a response at all? Now, the response of the individual is depending on few factors. The first factor is the presence of black hairs at the site of vitiligo. If you have black hairs on your vitiligo patches, there are very high chances that your vitiligo patch will go away. It will nicely pigment back. Second thing, if there are no hair at all, it's very difficult to pigment these areas with normal medical line of treatments or phototherapy that matter. It will always require procedures in the form of skin grafting in various forms. Now, what are the recent advances? The recent advances are in the form of phototherapy itself. It's the excimer laser, the wavelength of which is 308 nanometers. This is one instrument which gives very fast and quick results. But the only disadvantage of this treatment is that it covers a small area and of course it's costly. So friends, if you still want more of the knowledge of vitiligo and many other dermatological conditions, please visit DermaVidya, which will surely benefit you in a great way. Thank you.
For more such videos, visit or log into dermavidya.com.